My name is Tom Terranova, CEO of Quad A. I'm here to talk to you today about responsible marketing strategies for your facility. Thank you for joining us, and if you haven't already checked them out, please see our other talks in conjunction with AAPD about compliance in your pediatric dentistry facility and building patient confidence in your practice. For a bit of background, for those of you who don't know why you're listening to me talk to you, Quad A is a nonprofit, patient safety-focused organization that does accreditation in the healthcare setting, and we've been doing that since 1980. We offer a peer-based program and an educational approach that's distinguished by four main differences with other organizations and state agencies. First, Quad A has a 100% compliance mandate. I know it sounds like a pain, but especially in small and medium-sized practices, we feel that having a 100% compliance mandate really sets the facility up for the best possible long-term success that they could have. We also have mandatory data reporting. This is unique in accreditation and regulation, to my knowledge, all over the world. Every single practitioner in a Quad A accredited facility reports random cases and unanticipated events periodically throughout the year. Another distinguishing feature of our accreditation process is specialty training. We require that every practitioner in a Quad A accredited facility has received extensive specialty training within the services that they're providing in the facility. This is incredibly important because especially in unregulated and unaccredited facilities, practitioners can start to offer services that maybe they haven't had extensive training in. We feel that this is an incredibly important component of patient safety as it ensures that everyone throughout the care model has the right training to provide the care and to remedy any situations and unanticipated events that come up. Finally, unique among Quad A is that we require evidence of corrective action. Again, this sounds like an additional pain and an additional burden, but if you think about it from a small facility standpoint, it's pretty easy to come up with a great plan of corrective action to address any deficiencies that might be cited in an accreditation survey and have the best of intentions, but then to get busy and not to carry those all the way through to fruition. So for us to work with the facility, to be your partner for compliance, allows you to set up 100% compliance, correct any deficiencies, and be self-assured that as you go forward, once you earn your accreditation certificate, that you are on the best footing to succeed long-term. We've been doing this for 40 years. We've been working internationally for 20 years, and we've been working with AAPD since 2017, when the leadership reached out to us to ask for a really comprehensive and targeted program to meet the needs of the pediatric dentistry community and the high risks and high media attention events that were happening that were causing problems for the specialty. The goal here is to differentiate your community of highly specialized, trained, and appropriate service providers from those who maybe are not acting in the best way. And what we're going to talk about today in terms of responsibly marketing your facilities is how you communicate to patients, even before they walk through your door, how you're different from those other care providers that may not be putting patients, particularly children, in the best and safest position. You know best the many challenges to having a successful practice. You need to be the best dentist you can be while trying to be savvy in business and marketing. There are natural tensions in maintaining this balance. To make things even more difficult, great centers are often victims of being caught between slick marketing from other centers whose unqualified or maybe less qualified personnel may cut corners to keep costs at an artificially low level, or maybe they're just doing things that they shouldn't be doing. They feel comfortable, they feel confident, but maybe they're just not up to your level. Let's take a trip to business school to touch on one of the basics for business level strategies. Many of you may know this already, but let's just review to ensure we're on the same page. The most popular set of generic business strategies is based on the work of Professor Michael Porter from Harvard Business School. The key point for this conversation is that any business can realize a competitive advantage through either cost or differentiation. You can obviously dig deeper, but let's stick to the basics. In its simplest form, the model indicates that some player in the market will have an advantage because they offer good or service at the lowest possible cost. Alternatively, some player will have an advantage because they offer a value, whether it's higher quality, higher safety, whatever it may be. And there's a continuum that will allow each consumer of the good to decide where they want to fall on the cost and quality basis, or cost and differentiation basis. Because of this, you as a facility have to find a way to differentiate or be lower cost. And low cost, in my opinion, in healthcare, unchecked, is never a safe proposition. In fact, it's terrifying. In 2021, Quad A conducted research into patient perceptions and decision making. This research included a specific deep dive into the thoughts of parents of children aged 2 to 10, your patient's parents. As you can see from the word cloud on the screen, based on real patient responses, patients commonly felt confused, overwhelmed, stressed, or other variations of these emotions when picking their healthcare providers for their children. Patients do not feel there is any differentiation in the marketplace. If there were big differences in providers from their point of view, patients could easily identify among the available information, there would be clarity instead of confusion. Here, there's no differentiation. The only competitive advantage currently presenting itself in the market is cost, meaning the least expensive practices have an advantage. As I said before, runaway cost cutting to provide the cheapest care is terrifying to me in healthcare. The good news is there's a great opportunity to change the conversation and implement differentiation strategies to realize competitive advantage in the market. Taking a step into the mind of the patient, we want to see the underlying assumptions that about providers, their ethics, and their ability to provide dental care that patients use and what factors they can rely on to make their decisions. Their assumptions often have nothing to do with the underlying fears and concerns they have, but are simply a function of what information they have at hand. When we conducted our independent third-party assessment and study of patient decision-making, we found that patients basically presume that any healthcare practitioner is the same. It's shocking, I know. We all do a great job of sitting around as colleagues in a room and talking about people's training, people's residencies, people's fellowships, what programs they work through. But patients really are not able to discern these technical factors. In fact, 29% of patients simply look for the professional designation when making a choice. In the case of our study, we clumped MDs and dentists together. When we parsed out the information, there was no big difference between the dentistry statistics and the medicine statistics. So the overall statistics hold the same. 29% of patients, once they see DDS or DMD after your name, simply stop thinking. They simply take you to be one of many interchangeable dentists. And while you know that's not true, this is the patient perception, and it's really the only thing they have to go on. A further 44% of patients simply want their doctor or dentist to have experience. But as we see throughout myriad examples, patients don't have an ability to understand if you have experience or not. They don't know which programs are good or bad, or their relative distribution among that high quality to low quality scale. And they have no understanding of the number of cases that you should have done. This isn't to say that patients are ignorant, they just have no ability to understand this because they're not exposed to it. They don't know the programs, the professors, and they don't know the quality of training. So experience is often assumed. So if we look at this together, we see 29% of patients and 44% of patients are looking for a dentist, period. You become a grain of rice once you're a dentist and indistinguishable from others in many cases, in at least 29% of the cases. And further, once they see that you're a dentist, they assume you have experience. And therefore, we've cut out a huge amount of discernment, and we've allowed for the confusion to reign. So it's really important to understand this going forward, because if you're in a medical society or a dental society or a specialty organization, it's really hard to appreciate the knowledge asymmetry that you have from the general public. The first challenge to overcoming market confusion is establishing contact with your potential patients. You need a patient to call or make an appointment with you in order to have a detailed conversation, to establish a rapport with them, and to inform them about what makes differences between you and other care providers. What makes you the best care provider? As we all know, the internet is a massive marketplace with endless search options that make it really difficult to discern one provider from another. We know that most patients use basic search terms like dentist near me, best pediatric dentistry in Chicago, Austin, whatever city it may be. And these search terms are likely to produce results containing a mixture of well-trained, appropriate pediatric dentists and those who might be offering those services without the same training and background, and particularly with the sedation element. Search results confuse patients, and they put discount providers or maybe less trained providers on the same pages as you. And we know from Google Analytics and other search term analytics that patients really are only going to look at the first few results. And as they click around, they must rely on what they see in order to make decisions about what dentist to call or visit for more information. If everything looks the same, patients are going to pick based on price and convenience. And in many cases, this can create a race to the bottom, or can at least eliminate your differentiating factors of quality, safety, training, etc. To use an automotive example, you as a practice need to decide if you want to be the Kia or the Mercedes. Kia is often the most affordable brand in any market that they serve, and can win tons of business by being affordable and approachable. Mercedes offers far fewer options and far fewer sales than Kia, but the price point is so much higher because of its quality and luxury and engineering. And so the same can be applied to dentistry. You have to decide where you want to fall on that quality and cost per continuum, and allow your patients to discern with knowledge who they want to go for. You need to justify what makes you different, and that will allow you to maintain your proper profitability and attract patients, even if you might be pricier, farther away, or in some other way less convenient than other practices that Google kind of lumps you in with. It'll also help you attract patients that might otherwise simply click around aimlessly and pick whoever happens to have a pretty website. Websites and social media of qualified and unqualified practitioners offering pediatric dental services do not offer any clarity. The sites often look the same, they're often made with the same website builders, and really, without getting into which of these websites on this slide look better and which one is more attractive, I think we can all agree that it's indistinguishable, that they are very much in the same world and that they are very much of a similar quality, and it's not clear which dentist is board certified in pediatric dentistry and which uses qualified anesthesia providers, and which have really unknown of these variables. Again, most of these websites are visually pleasing. They're created using the same companies, such as marketing companies. They use the same templates, and they use stock images of happy models and something that attracts children and makes parents feel comfortable that it's going to be a nice, fun, inviting environment for their children. Even if patients explore the websites to review the provider's background and education, the language used is remarkably similar. In the example above, these are taken from the exact same websites that were on the previous slide. The dentists claim to have completed the required training without specifying what that is. And from the wording, it appears that the dentist is doing their own sedation. In the second example, it very specifically indicates that an anesthesiologist only provides the anesthesia and sedation for the dentist. The third example makes no mention at all of who provides the anesthetic. The fourth example very clearly sets out the involvement and the importance of an anesthesiologist. Some sites are better than others, but the variation here contributes to the confusion. Incidentally, these centers are all in the same geographic area, so practices that are doing the right thing can be harmed by those who maybe are not. Continuing with our car analogy, when you think of Mercedes, what do you think? When you think of Ferrari, what do you think? Volvo, it's all the same. These cars cost more, these cars are flashier, but they're better than the average car in some way, which makes which makes customers willing to pay more, go out of their way, or in some other way inconvenience themselves to take on the responsibility of buying that car, that product or service, rather than just looking for what's most convenient. The lesson here is that the design of your website and the information about your providers often fail to establish a clear differentiator, or any reason that the patient should pick a qualified AAPD member that does things the right way and is assured of doing the right way from someone else. If prices, location, and other comparable items are the same or marginally different, the patient's choice might be a coin flip. As a result, the inherent incentive is to reduce costs, to try to be convenient, set up more locations, and be as apparent to the patient as you possibly can. And in the worst case scenario, people may even start cutting corners or necessary processes or shortening timeframes that lead to higher risks. If you're stretching supplies or equipment to be able to offer more services more frequently at a faster pace, the race to do all of that can lead to risks that I don't think any really responsible provider would like to undertake. The patients need a reason to find you and you alone. And so far, we don't see it in centers' online presence. It's also important to understand that information about training and information about education and experience is easily replicated by other people. If you're an AAPD member, someone may belong to another society. If you have a fellowship, someone may have had another fellowship. If you've practiced in 2 different countries, so might someone else. So all of those things are easily repeatable and scalable for other practitioners, And again, they rob you of an opportunity to differentiate yourself. Adding to all of this chaos is social media. This is a necessary tool, a useful tool for the best dentists, but it can also be dangerous in the hands of others, including some who spend more time on marketing than being a great provider. If a practice spends a ton of time and energy on their social media presence, have they, as the director of the facility, sufficient capacity to focus on their practice, on staying up to date in techniques? If their financial resources are being consumed with marketing, are they less willing to engage and pay for qualified anesthesia providers? None of this is to say any of those actions are bad, but do they come at the cost of their practice? Or are they coming at the cost of the attention that the practitioner is paying instead of them paying outside professionals to do the job that they should be focusing on so they can be the best dentist they can? There are many social media PR agencies specifically devoted to increasing practice profiles on social media and online to ensure that their client is in the best position to succeed in the marketplace. Those organizations don't have an inherent need to make sure that the qualifications and the services are the safest. Unfortunately, dental care can sometimes be seen as trivial. It can be commoditized. The other side of a patient being so much more careful about their kids' choices is to say, oh, it's just a little dental work. So there's sort of a split in patients and in parents. In many cases, parents want to be extra careful for their children. But in other cases, patients sort of put dentistry aside as something that's not that invasive, that's not that dangerous, and that doesn't really have risks. And the more anyone with a social media account can provide care that looks the same as anyone else, that shows smiling kids and happy interactions, the less there seems to be reason for patients and their parents to search out the best practice in an area, the safest practice in an area, and to make sure that the risks are fully mitigated and that any emergencies can be dealt with. Ignorance, in this case, the patient's ignorance, because of the abundance of information, blooms in this sort of environment. Not only do clinics and centers struggle to differentiate themselves to win over patients from the massive population of competing clinics within their market, right? There's confusing marketing, there's widely varying legitimacy among those practices, but there is a sizable segment of the population that will not consider any care for their children in a non-hospital setting. This dynamic may be changing a bit due to COVID, but our data was collected right in the middle of the pandemic. And make no mistake, your training and affiliations do matter. It's really important, and they undoubtedly help you win business and win patient trust. But talking only to your patients, however, risks a lot of selection bias. So patients come to you because they know you, but if you ignore the broader patient population, you won't understand that many providers are blind to the fact that patients that they talk to, their own patients, are confirming the reasons that they've already chosen you. And they're sort of not understanding the fact that they might have lost a lot of patients along the way. So there's a great insight here on this slide from our research that shows that essentially in a non-hospital environment, 35% of patients are unlikely to seek elective care. And that means 35% of parents of children are unlikely to seek elective care in a non-hospital setting. So when you think about dentistry, maybe that number comes down a little bit, but with sedation, I think that it's really reasonable to think that patients are going to be leery on that same proportion that they are for all other healthcare. Overall, patients want to be sure that none of this, what you see happen here, none of these tragedies happen to them. Certainly, you want to make sure that none of your patients wind up with after photos like these on the news. You can and should establish a marketing strategy that utilizes messages detailing the importance of the things that you do on a daily basis to ensure that these tragedies never happen in your center. Obviously, you want to do that without fear-mongering, but it's important to be transparent with your patients. Patients' highest concerns, as you'll see in other talks, if you join our other talks and watch our other videos that we produced, you will see that the top 5 fears of all patients and parents have to do with emergency preparedness and responses to emergencies. By proactively demonstrating the best practices that you've implemented throughout your center, not just you and not just interprocedurally, but for safety, for sterility, all throughout your center and with all members of your team, you can change the conversation of one from cost or convenience to differentiate your center from the noise on the internet. You can talk about the quality of your nurses, your staff, their compassion, their knowledge, the processes they follow in a way that addresses the underlying patient's concern about risks, infections, and how you would respond to those. without explicitly accusing others, your neighbors, your colleagues in the neighborhood, of being unsafe, and without resorting to overly emotional means to scare patients, you can challenge your competitors to meet your standard, to come up to your level, and to implement similar measures. Because the rising tide will lift all the boats, right? And we don't want low quality brands and low quality practitioners dampening your quality and your safety. We want every AAPD dentist, everybody who's practicing sedation dentistry appropriately, to lead their team, but to be a role player among the rest of the team that exhibits quality, safety, competence throughout the center. And that, above all others, is the strongest message that you can give to a patient. Based on the responses to the studies that we conducted, patients were able to articulate the messaging that most appealed to them, that worked to calm their main concerns, and to convince them to consider a site for elective care. This is how you best win patients over. And if you refer back a couple of slides to the statistic that I said, that 35% of patients will not consider elective care in a non-hospital setting, I want you to realize that if we isolate those patients, those skeptics, 58% of them were willing to be convinced otherwise and to start considering elective care in a non-hospital setting if they could be convinced of certain things like accreditation and all the things that accreditation entails. Really, they want to know about compliance and safety. And the three most powerful messages from the mouths of the patients themselves was that knowing the entire staff, including nurses, techs, administrators, etc., are checked and are of the highest quality, and they undergo routine training and retraining, that made the biggest impact. If you see here on the slide, this is what's called a max diff study. And a max diff study establishes a baseline of a 100 perception of a facility or a message. And then it tests every single message against that to understand which is the most impactful, how far it moves the needle in terms of their perception of you, of your facility, and of your staff. You can see here that there was a 20% increase among the patients about your facility or about trust in a generic hypothetical facility to know that the entire staff is trained. It's not just about the dentist. Knowing that you're board certified, that you have the appropriate training, that you have the appropriate fellowship and specialization was also powerful. It was the second most influential message. And then also knowing that there's a comprehensive emergency plan, risk assessment, and that there's appropriate equipment in the center was very beneficial to the messaging for patients. These are three components of Quad A accreditation that we've developed with AAPD that patients easily identified as part of the accreditation. Once they learned even a small bit about accreditation, they knew it entailed these major messages and really reacted to it, as you can see here from the data, how far that it moved the needle in terms of their perception. Additionally, this is what truly differentiates one center from another in the evaluation process. In the context of being the lowest cost or the most convenient provider becomes so much less important because now the patient is adding 20%, 14% to their perception of you because of your training and specialization, your staff's training and specialization, and your ability to respond to emergency. Putting these messages in front of your patients transparently and honestly puts you on a completely different level compared to other competitors' websites in a way that they cannot really replicate and that speaks directly to the patient desires. The last piece of good news is that getting these attractive messages out to patients is simple. Again, this is directly from the patient's mouths. Ensuring your website contains messaging, linking back to Quad A or other websites that provide accreditation, regulation, and support and evaluation of your organization, support these best practice messages. Ensuring that your search engine optimization and social media prominently feature all of these talking points is really important to patients. Discuss these differentiators with your major referral sources because often they're referring patients or talking about you because of their interpersonal relationship with you. But if they can put more substance, more technical assessment, and more expertise behind their referral to you, it will mean so much more to patients. As you can see from this graph, each of the marketing and communication channels that I'm talking about here were listed as either a good way to reach patients or the best way to reach patients from their own perspective. So you can see how big and how many patients this messaging can reach if you take advantage of the messaging they want to hear and the way they want to hear it. Essentially, what you're doing by taking on these quality efforts, implementing them in your practice, talking about them to your facilities is establishing yourself as a luxury brand. You want to be the Porsche, you want to be the Mercedes, and not the Kia. Once you decide to do that, the next step is accreditation. I've said this 1,000 times in my life, and I'll say it 1,000 more. Accreditation involves 500 to 700 different technical standards that most patients cannot assess. They will never walk through your facility and check off your sterilization techniques, the biomedical recalibrations of your equipment, and the dates on all of your supplies. But that's what accreditation does, and it offers an arm's length, third-party, impartial assessment of your facility that patients can recognize easily and quickly as the yes answer to all of those 500 to 700 technical questions. So that's the polishing up, that's the detailing of your luxury brand. So once you decide to put all of those messages in front of your patients, I encourage you to make the choice to follow AAPD's lead and to follow through on the accreditation of your center. Because again, this is something that those people who should not be doing pediatric sedation dentistry cannot replicate. They will never meet those standards. They'll never be able to replicate your achievement. And doing this will allow you to stand apart from that market in your community. I want to thank you for your time, for your attention, and for joining us on this and other talks. If you want to learn more about accreditation or even just learn more about other ways to keep your practice safe and to make your end use and your services better and safer for your patients, I encourage you to contact our office. I also encourage you to contact American Academy of Pediatric Dentistry to ask them questions about this initiative and to be put in contact with us. I hope that you found this talk to be enlightening in terms of how you talk to patients, because I think that's just as important as how you practice on a daily basis. If no one knows about it, it's not really a benefit to you other than keeping your patients safe. That's obviously the best reason to do it, but you should also take credit for those wins. Thank you.